Hello everyone and welcome back to my YouTube channel. So today's topic is about a list of laboratory diagnostic tests and the indications and the interpretations from the same. So we'll be covering all the diagnostic tests for liver, kidney, lungs, neurological conditions, stool examination, pulmonary conditions, etc. So firstly, we have a number of tests that could be carried out. It could be either biomarker test. So we just take out a particular biomarker of that is increasing or decreasing in a particular disorder. Next, it could be a smear examination. So smear is prepared. Or it could be a microbial staining like gram staining, acid fast staining. So your mycobacteria in tuberculosis that is caused due to Mycobacterium tuberculosis that is identified via acid fast staining. Your gram positive and gram negative bacteria are also identified using gram staining. Then you have certain biochemical tests like carbohydrates, proteins, so these carbohydrates, proteins, amino acids, you have these tests that are included in the biochemistry. Then you have hormonal tests like in pregnancy, the HCG, that is human chorionic gonadotrophin hormone. Tumor markers, these are markers that are usually in cancer. So there are certain cells or there are certain markers that are increased in the cancer like GPX4 cells in breast cancer. So there are a number of markers that increase in a particular condition. Next is coagulation test. So these tests are basically for hemorrhage. If your blood doesn't clot, majorly in diabetes people, it takes a prolonged time for the wound to get healed. So there is excessive bleeding. So in that case, you go for coagulation tests. Also, they could be used for some other proteins as well, not necessarily blood. Next is hematological, that is called as blood test. So blood test may you will have a number of parameters that we'll be covering ahead, but mostly we go for RBC, WBC, platelets, MCV, PCH, CBC, hemoglobin, hematocrit, etc. These are the different criteria for any blood test to be carried out. Next you have is hepatitis markers. Hepatitis mostly liver, lungs. There are certain markers that are elevated in hepatitis. Immunological or serological testing. So immunological and serological testing are also very essential because they could be used for sexually transmitted diseases like syphilis, gonorrhea, or some antibodies or some antigens invasion in our body. So that is why it is very important. We also have hemagglutinin test as one of the immunological tests. The next test that we have is blood culture test. So the blood culture test is mostly to see whether there is any infection, whether there is any. It is a basically laboratory test in which your blood will be, in which blood is injected into bottles which have culture media. So one can come to know whether there is this kind of microorganism in that particular culture. If it grows, that means there is that particular microorganism is present in the blood. So this is one of the very important parameters when we speak about the blood culture test. And in basically in blood culture test, you see the which bacteria is invasive and which bacteria is less invasive. And the next one we have is genetic test. So these genetic tests are mostly for epigenetic studies, or these are for any like pre-diabetic test. Also nowadays there are pre-cancerous cells. So before you actually get cancer, you will come to know that you are in next 5 years you will suffer from this cancer. So you directly go for a surgery or you go for medications. Like in one of the very famous celebrities, she was supposed to get breast cancer in the next 4 years. So she just removed her breast. So the chances of the cancer and the spreading or invasion was nullified. So this is an example of one of the genetic tests. It basically deals with all the genetic disorders, all the disorders that includes DNA, RNA. So that is major purpose of these tests. The next one we have is serum electrolytes. So there are certain electrolytes in our body that elevate or that reduce and cause certain conditions. Mostly sodium, potassium, calcium, magnesium, chlorine, bicarbonates, phosphates. These are few of the ions that are responsible for our different pumping system as well. Like we have sodium potassium ATPase pump, we have hydrogen potassium ATPase pump. This hydrogen potassium ATPase pump is responsible for acidity. So whenever you get an acid reflux, if you sleep at night, you feel like you have a very burning heart, you will feel a little uncomfortable. That is due to the hydrogen potassium ATPase pump is more activated. So we give proton pump inhibitors like pantoprazole, pan 40, pan D, all these medications for the same. Sodium potassium ATPase pump, sodium potassium 2 chlorine co-transport. This is responsible for your diuretic action. Sodium potassium 2 chlorine co-transport. Sodium chlorine symporter, again your diuretic actions. Sodium potassium ATPase pump, your digoxin, which is used in heart failure, congestive heart disease disorders. So that plays a role in the sodium potassium ATPase pump. So these electrolytes, whether it be intracellular or extracellular, whether it be cation or anion, irrespective of its nature, it has to be in a particular level. So here you can see what are the normal levels and what is the range in adults, in kids, and in newborns. So there are different categorical classifications based upon the age groups. So geriatrics, that is the old patients, the adults, the child, and the infants or the newborns. So these, there are certain critical values, like for suppose sodium for adults it should be within 135 millimoles per liter. For potassium in adults, it has to be within 3.5 to 5 millimoles per liter. So you can just take a screenshot of the same or just go through the normal average ranges for the same. So you can yourself interpret your reports as well. You don't have to wait for the next day to go to the doctor. You can at least self-diagnose, or that is not advisable though, but yes, at least you'll have a relief, or you'll come to know about what could be the consequences further. The next up we have is cardiological or heart screening. So in basically over here we have few enzyme or biomarkers like lactate dehydrogenase 1 and 2, troponin, creatinine kinase. These are basically three major biomarkers: creatinine kinase, troponin, and lactate dehydrogenase, that are involved in your cardiological functioning. So mostly the troponin is very sensitive for myocardial injury, that is the heart injury. Creatinine kinase is associated with the skeletal muscle damage. So your cardiac muscles are your skeletal muscles. So they are involuntary in nature. You cannot control your heart muscles. But yes, you can control when you want to lift your hand, when you want to walk. That is voluntary. Respiration, again, आप अपनी respiration control नहीं कर सकते. That is involuntary in nature. So you can hold your breath for some time, but yes, it is not at all voluntary. So these are few of the biomarkers. CRP, that is the C-reactive protein. This was also a biomarker in COVID-19. If its level is increased within 12 hours and go back after the 72 hours, so that means it has more specificity for acute cardiac infarction or myocardial infarction, that is heart attacks. So there are different heart attacks types as well. If you are getting a heart attack for the first time or if it's for the second time, depending upon the levels, you actually go for diagnosis and treatment. AST, that is the aspartate transaminase, is a very important biomarker for acute cardiac disorders. Then you also have PBN, that is the pro-brain natriuretic peptide. So brain natriuretic peptide is a protein, and you check the amount of protein levels in the body. That is also important. Here you can see I've listed out few of the normal levels of the creatinine kinase, of the troponin. It should be less than 0.4 nanograms per ml. Imagine the intensity and the volume of these biomarkers. There are different types of natriuretic peptides. It's not just BNP, that is brain natriuretic peptide. It could be atrial natriuretic peptide, or it could be C-type natriuretic peptide. So these are all cardiological biomarkers. The next you have is urine test or urine analysis. So there are firstly different, these are also called as nephrological tests, because nephrons means kidney. So urine analysis is basically performed in different conditions, but there are two types of analysis we can say. First is morphological or organoleptic. You check the color. The color of the urine should be yellow. It should be pale yellow. It should not be dark yellow. It should not be white. It should not be red. It should not be black. It should be pale yellow. The odor should be aromatic in nature. The turbidity, whether there is any cloudiness in the urine when you're urinating. Is there any pus cells? Are there any the pH of the urine? It's mostly a little acidic in nature. That is why the pH is around 4.5 to 7.8. The specific gravity, you check the amount of protein. Protein must not be present in an excessive quantity, otherwise you can suffer from proteinuria, that is proteins in the urine. Next is ketone bodies. You can suffer from ketonuria if there are any ketone bodies or ketones present in your urine. Bilirubin and biliverdin, these are two conjugated and unconjugated forms that are available. The bilirubin is basically pigments, so these should not be present in your urine. Next is the cells, the RBCs or WBCs, that is called as hematuria. If you get the blood in urine, that is called as hematuria. It should be less than, the RBCs and WBCs should be less than 3 cells, and the bacteria, there should be almost none. Crystals, of course, there should not be any crystals, or you can suffer from kidney stones. Kidney stones could be of different types: urolithiasis, nephrolithiasis, ureterolithiasis. That means stone could be present in the kidney, stone could be present in the urethra, stone could be present in the ureters, or it could be present near the urinary bladder. So the if there is any stone present, the diameter, how much ka stone it is, that is also very, very essential. And then you check the amount of electrolytes: sodium, potassium, magnesium, nitrates, and urobilinogen. Urobilinogen is not muchly used, but yes, its level should be within 0.01 to 1 Ehrlich's unit per ml. The next you have is neurological screening. So neurological means related to brain. So there are different brain disorders and biomarkers like Alzheimer, Parkinsonism, schizophrenia, bipolar disorders, depression, mania. So in schizophrenia, usually when you say that it is a condition wherein you are actually very confused, you are actually hyper excited. Alzheimer is cognition, your memory, you start forgetting things. Parkinsonism is getting rigid. When you would have seen certain old people, they walk a little bent. Their back is not straight. They cannot stand straight. That is Parkinsonism. Rigidity and tremors. Their hand shakes. They cannot hold anything properly. Those are few of the signs of Parkinsonism. Bipolar means two personalities. Sometimes they behave very nicely, sometimes they get angry, or sometimes the mood swings are very, very quick and frequent in bipolar disorders. So these could be by either EEG, that is electroencephalograph. It's not ECG. ECG is for heart and cardiac. EEG is for encephalon, that is the brain. Then you go for cerebral angiography, carotid Doppler, brain scanning, lumbar punch, myelogram, MRI, that is magnetic resonance imaging, CT scan, that is computed tomography with or without a contrasting medium. Then there are certain blood tests or the certain osmolality that you check, because osmolality is also very, very important factor um, with respect to the blood test when you for the neurological conditions. Next you have is blood glucose, serum ammonia, serum electrolytes, ABG, that is arterial blood gas. It measures the amount of oxygen and amount of carbon dioxide. So आपकी brain को it is very, very essential that oxygen must reach so that there is more blood flow in the brain, so you can remember things. The vascularity of the brain is maintained. And this is also called as acid base balance. So arterial blood gas can help you determine the acid base balance. And one interesting fact, if you eat something that is more sweet, more amount of glucose and blood levels could vascularity could increase. So when people say that meetha zyada nahi khana chahiye, it is sometimes good as well, because of course diabetes mellitus is one of the fatal things that comes with eating sweet. But yes, when you eat sweet, more amount of glucose reaches. And next up we have is alcoholism. So if you have any drug, if you have any dependency, matlab, if you are having certain medications continuously even without it getting prescribed, so those could also be diagnosed by neurological testing. The next you have is certain tests that are miscellaneous. One of them is sputum test. So sputum test is mostly for TB, that is tuberculosis. You next have is allergy test. So many people have allergy from pollen, from dust, or from any other food intolerance tests. These are also called as food intolerance test. And they could get cough, they could get sneezing, they could get vomiting, or a feeling of nausea, a lethargic feeling. So that could be determined by the allergic test. Smear or biomarkers test. Sleep apnea. So when people are not getting sleep, matlab, you would have seen old people most majorly complaining कि नींद नहीं आ रही है. That is because apnea. So your melatonin cycle is very disturbed. That is because either because your sleep cycle is not going in hand. That is one of the reason. Then you have pre-diabetic test. So before you get diabetes, there's a small indication that yes, you're going to get pre-diabetic, just like the recharge of your phone. Before the recharge gets over, 2 days prior, you get a notification that your recharge is going to get over on this date. Similarly, pre-diabetic could you could compare that yes, below this date, at this time or at particular date, you might suffer from diabetes. Histopathological screening is basically tissue. So biopsy is one of the histopathological tests, majorly in cancer diagnosis, where you remove a small piece of tissue and check for the invasion or growth. Pre-tumorigenic test. Pre-tumorigenic is very useful nowadays because almost in Asian and certain other countries as well, northern countries, there have been lot of invasion of cancers: prostate cancer, blood cancer, lung cancer, breast cancer. So these could be identified earlier. And the last one you have is 2D echo and 3D echo. The echo test is basically for heart, for cardiological screening. So this image you can see is of the food intolerance test. So certain people are advised कि आपको बाजरे की रोटी नहीं खानी चाहिए or something like that. You should not eat pomegranate. You should not eat papaya. You should not eat crabs. So these are the few products on which eating and consuming these products you could get allergies, like coffee, tea, oyster, crabs, eel, lobsters, fish, salmon fish, cow's milk, egg yolk, buffalo's milk, egg white, tuna fish, avocado, blueberry, blackberries, dates, that is khajur, grapes, guavas, lemon, papaya, orange, pear, cereals, flax seeds, that is linseeds, oats, rice flour. Then you get wheat, aloe vera, malt sugar, hazelnut. So these are few of the and other than these, there are certain spices as well, like bay leaf that you call tej patta, anise seeds, basil, that is tulsi, clove, cumin seeds, that is zira. So there are certain people who have these kind of allergies to this food. So they could be identified in the allergic test or the food intolerance test. The next is the liver function test or the hepatological test. So your liver is one of the largest organ of your body. And liver में mostly whatever you have, there are certain metabolizing enzymes. So आप जो बोलते हैं कि आपका खाना पचना चाहिए. So there are certain enzymes, not just in your bowel. There are certain enzymes that are responsible for metabolizing food that are secreted from liver. Basically, you have two tests, SGPT and SGOT, that is serum glutamate pyruvate transferase and transaminase, and serum glutamate oxaloacetate transaminase. They are also used, AST is also used as a biomarker in cardiological testing, that is aspartate aminotransferase, and ALT is alanine aminotransferase. Mostly it should be within sigma Frankel units of around 0.1 to 0.30 or 0.1 to 0.92 microcats per liter, or it could be around 10 to 55 units per liter. Mostly your SGPT, SGOT level has to be less than 40. That is ideal one. Then is amylase. So there are two types of amylase. One that is secreted in your mouth. So when you eat, think or see any delicious food, so आपको salivation होता है, बोलते हैं मुंह में पानी आ रहा है. That is because amylase enzyme is being secreted. And the other is pancreatic amylase, which is responsible for your digestion. Bilirubin is in two forms, conjugated and unconjugated. So those levels are also needs to be determined. Besides this, you also check the lipase, ammonia, and the albumin level. So hyperalbuminuria or proteinuria. That should be avoided because albumin is a protein, and a protein must not be seen in much quantity in liver, urine, wherever, whichever secretory route. So that needs to be taken in consideration. The next up we have is the pulmonary, that is lungs. So here you have certain pulmonary function tests like spirometry, lung volume, diffusion capacity, maximum respiratory volume, maximum voluntary ventilation, ABG, that is arteriolar blood gas, pulse oximetry, bronchoprovocations, and, and tidal volumes, peak expiratory flow rate, exercise testing. So you might be given a certain instrument or a device that in which you have to blow and there's a ball which rises up. That determines your capacity to respirate, your capacity to breathe. So jitna wo ball upar jayega, the more is your breathing capacity. That is called as breathing index. So there's a tube, vacuum tube connected to that in which you have to breathe in, and then you have to blow up through the tube, and then the ball rises up. And then there are certain interpretations, obstructive or destructive. There could be different diseases like asthma, COPD, that is chronic obstructive pulmonary diseases, bronchitis, cystic fibrosis. Cystic fibrosis is mostly seen in females. There are fibroids that are formed. So also hemorrhagic cystitis is one of the causes, that is due to cyclophosphamide consumption. Emphysema, silicosis, asbestosis, that is due to exposure to asbestos sheet, either blue or brown. So if there are certain workers who are working like in Diwali, there are many workers who worked in a Diwali crackers field. So they get exposure to those smokes. Similarly, there are certain people who work in industries for silicons, for asbestos. So they might suffer from these lung disorders, scoliosis, interstitial fibrosis, obesity, lung resuscitation. So these are few of the tests that you can opt for in the pulmonary, that is the lung screening. The next up is the inflammatory mediators. This is one of the novel and the modern technologies wherein you check the inflammatory mediators ka level, mostly histamine. So whenever you suffer from any small allergic conditions also, histamine is responsible. Like suppose if you are itching, some ant bit you, so you obviously the area gets red, you start itching, you start scratching that area. That is because histamine, one of the inflammatory mediators. Even when you are getting a cough, whether it be a productive dry or a wet cough, histamine is majorly involved. That is why in major cough syrups you will see chlorpheniramine, diphenhydramine, they are added. Also certain cough syrups, you after you have them, you get a dizziness, मतलब ऐसे बोलते हैं कि नींद आती है. That is because antihistaminic, anticholinergic action is one of the major thing. And dry mouth, that is one of the most important parameters. So गला जो है वो सूख जाता है, you don't feel like eating anything, you don't feel like consuming anything, there is no salivary secretions. Even what if agar aap the dish that you mostly like, even that if is offered to you, you would reject that because there is so much of dryness in your mouth. PGD, that is prostaglandin D, LT, that is leukotrienes, and tryptase. These are basically for congestion, for nose, um, where you use oxymetazoline, that is otrivin, xylometazoline, that are nasal decongestants. These are responsible for urticaria, that is itching. Again, urticaria is itching of the skin. Pruritus, again nasal pruritus or corneal pruritus. Keratitis, headache, diarrhea. Yes, in diarrhea as well it is responsible, and hypotension. Here you can see histamine, the inflammatory mediator elevations and reductions. How can it affect in which diseases? TNF, that is the tumor necrosis factor. So basically in cancer, the people who have cancer, TNF alpha test is performed because cells की अपनी एक ability होती है to kill those cells. Whenever a cell is not able to kill or automatically undergo phagocytosis or necrosis, that means जो deadly cells है, जो cancerous cells है, वो grow कर रहे हैं. That is why you say cancerous is a chronic cancer is a chronic condition. एक बार आपके cells multiply करने शुरू हो जाते, it is very difficult to control it, and it is a rapid invasion. That is why TNF, tumor necrosis factor, helps in controlling this. Then next you have IL, that is interleukins. Interleukins basically are dealing with the lymphatic system and the eosinophilia, that is the RBCs. Hematopoiesis, of course, the blood cells formation. That is why you say that blood donate karna chahiye, because whenever you donate blood, there is formation of new blood cells. There is hematopoiesis from the bone marrow. So that is why blood donation is also again a good cause. You can interlink that. Here is a list of different biomarkers: cytokines, proteins, histamine, chemokines, GM-CSF, that is very, very important. And the medications of GM-CSF are also very, very expensive. बहुत ही महंगे आते हैं. That is granulocyte macrophages colony stimulating factor. These are basically associated with infiltrations, with eosinophils, etc. So these biomarkers not only used for systemic action, they can use for skin, respiratory or GI disorders. In peptic ulcer, so ulcer is a disease where there is erosion, the mucous membrane is eroded. So peptic ulcer is called, in this condition, histamine level, again PAF, that is platelet activating factor, that is responsible for abdominal cramps, and especially in females when they are undergoing menstrual cycle, there are menstrual cramps, there are abdominal cramps. So in this condition, mephtal spas is given, that is mefenamic acid. So the pain, the condition, it could be controlled, the amount of pain that they are going through. So that is one of the factors where you can see this. In skin, you have angioedema, flushing and all, in which bradykinins are responsible. PGE, that is prostaglandins. And here you can see the types of inflammation. It could be either acute or chronic depending upon the amount of inflammatory mediators, the type of inflammatory mediators released. Up next you have is blood test, that is hematological testing. Hematocrit is the volume of the PCV, that is packed cell volume, and represents the percent of the RBCs. These are the normal levels. ESR, that is erythrocyte sedimentation rate. Mostly inflammatory disease में ESR check करते हैं. In tuberculosis, TB, ESR is a major criteria for diagnosis. MPV, that is mean platelet volume, and platelets, these are very, very important because they play a role in coagulation. They play a role in hemostasis. So अगर आपको कोई prick करता है किसी needle से, आपको blood clotting होने में थोड़ा time लगता है. Always remember that the bleeding time should be less than the clotting time. So जो कितना ज्यादा bleed हो रहा है वो कम होना चाहिए clotting time से. ऐसा क्यों? Because a person, if he or she bleeds excessive, there is a more amount of blood loss in the body, and that could be very difficult. So hemoglobin, of course, hemoglobin is one of the very important factors, and hemoglobin ka level maintain hona is very important, otherwise you might suffer from anemia. So hemoglobin normal level in males is around 13 to 18 milligrams per dl, that is 100 ml, and in females it is 11.5 to 16.5 milligrams per dl, that is 100 ml. So there are certain foods जिसको खाने से आपका hemoglobin बढ़ता है, like pomegranate. Pomegranate is very good for hemoglobin. Spinach, strawberries, kishmish, that is raisins, dates, that is a very good food. Then red meat, chicken, mutton, that is a very good source of protein as well, and hemoglobin levels increase. Eggs, beetroots, these are few sources of hemoglobin. And next up we have is levels of few RBCs, WBCs, eosinophils, basophils. So their level increases in a particular disease, so that is important, like lymphocytes, monocytes, acidophils, basophils, and all. These are the normal levels of MCC, that is mean corpuscular hemoglobin concentration. Reticulocyte, TBC, that is total iron binding capacity, transferrin, ESR, MCV, that is mean corpuscular volume, hematocrits, hemoglobin. And hemoglobin you not just check in adults, you don't just check in geriatrics, that is old patients, or pediatrics, that is newborns, infants. You also check in pregnant women, and in along with pregnant women you check in lactating women, that is breastfeeding. Why so? because whenever a female is pregnant, mostly folic acid needs to be given because vitamin folic acid deficiency occurs in pregnant women, and that is a major reason. So in pregnancy and breastfeeding, the hemoglobin levels are checked. And besides this, there are certain other tests for coagulation, that is INR, internationalized normal ratio. The D-dimer test, D-dimer test was again very, very popular in COVID and mucormycosis, because it is used to find out if there are any blood clotting disorders like DVT, deep venous thrombosis, DIC, disseminated intravascular coagulation. Next, you have to check the APTT and PTT, prothrombin time, and the activate partial thromboplastin time, and the PTT, that is partial thromboplastin time. These are again all related to your blood coagulation. The next you up is have a thyroid function test, in which if there is hyperthyroidism or hypothyroidism. So there are certain disorders like goiter. So that is why you say that namak खाना is very very important, and namak में iodine होना बहुत जरूरी है. So Tata salt, they especially are responsible for iodine. So those people that live in the hilly regions, so आप पहाड़ों पे जाओगे, there you might see people who are suffering from goiter because iodine deficiency is quite prevalent in those areas. And these are the normal levels of T3, T4 and TCT, that is thyrocalcitonin. So T4 is thyroxine basically. These should be in nanomoles per liter or micrograms per deciliter. In certain tests, there are special tests like tests for sexually transmitted diseases like AIDS or HIV. So the ratio of CD4 cells to the CD8 cell, that is the helper cells and the killer cells, should be greater than 1. If it's less than 1, then a person might suffer from this virus. The T cells, the B cells, and the natural killer cells, they should be around these ranges. The next up we have is the lipid profiling test, that is the cholesterolemia, hyperlipidemia. So काफी बार we say that the person is becoming fat, the person is becoming obese. Obesity is dangerous, becoming fat is not. If a person is obese, then the lipid profiling testing, LPT, that is actually taken into consideration. So normal cholesterol, there are different types of cholesterol: HDL, LDL, VLDL. So whenever you take out the report, you will see these terminologies: high density lipoprotein, low density lipoprotein, very low density lipoprotein, triglycerides and cholesterol. So body में HDL होना जरूरी है, that is called as good cholesterol, because आपके fat से ही आपको energy आती है. The amount of basal mass index, the बेसिक मेटाबॉलिक रेट, जो बीएमआर होता है, मेटाबॉलिज्म, कैटाबॉलिज्म, एनाबॉलिज्म. सो फैट्स के ब्रेकडाउन होने की वजह से ही एनर्जी इज रिस्पॉन्सिबल, एटीपी इज फॉर्म्ड, माइटोकॉन्ड्रियल कपलिंग एंड सो मेनी एसोसिएटेड फिनोमेना. LDL is called as bad cholesterol. That means ये बढ़ने से, इसके लेवल के बढ़ने से there might be heart disorders as well, because एक बार ब्लड में फैट्स डिपॉजिट हो गए तो आपको एथेरोस्क्लेरोसिस, आर्टेरियोस्क्लेरोसिस, सांस लेने में तकलीफ होगी. There might be low oxygen level, low blood level reaching to the heart, and eventually heart failure, heart attack, myocardial infarction, etc. or cardiac arrest and the most severe and most fatal case. The next up you have is stool examination. So stool examination is basically your excreta, and again you have morphological macroscopic examination. Color. The color of the stool should be brown. It should be not so watery. It should be semi-solid in its consistency. If it's too watery, that means you're suffering from diarrhea, or there could be Escherichia coli, E. coli invasion. That is, you might suffer from amoebiosis, in which you have a stomach ache, you have lot of frequent stools, you have to go a lot of amoebic dysentery. There's a difference between diarrhea and dysentery. Just that's very important. Next up you have is if you have a little risy, a little watery stools, you could suffer from cholera. If there are any blood, if there is blood in your stools, that means there could be anal fissure, there could be rectal damage, or in most severe cases, it could be colon cancer. But anal fissure is basically when you eat more of fried food, when you eat more of spicy food, when there is more amount of oxidants in your body. So that at that time you need to have antioxidants. And amla is the most important and the most rich antioxidants. Besides this, there is green tea, dark chocolates. These are very good source of antioxidants. Lychee, pear, grapes, you have blueberries, you have kiwis. They are very good source of antioxidants. You have cabbage, beetroots. They are also tomato. Tomato is again lycopene. It is very good antioxidants. Having tomato is also very, very good. So in these conditions, you could and you could suffer from steatorrhea. And again, these are interpretations for the same. Next up we have is the color, and if it's brown, it's okay, it's normal. If it's black, that is आपके stools जो हैं वो काफी black हो रहे हैं, dark black. There could be bismuth salt, there could be charcoal, or there could be proximity to caseum, that is bleeding in the cecum. इफ इट्स टू रेड, बहुत ही ज्यादा रेड स्टूल्स है, तो आपके मोस्टली आपने कुछ ऐसी चीज खाई होगी दैट इज रेड इन कलर. One of the red, that is red food color in lollipop, in non-vegetarian food, basically in butter chicken, there is a lot of red food color added. So, and you could have hemorrhoids. Hemorrhoids is piles. Piles is treatable, yes, it could be either treated with medication or surgery, but they are very, very painful. Piles pain is extremely unbearable. There could be tumors, there could be anal fissures, as I earlier mentioned. Yellow, if it's yellow, of course, diarrhea is one of the major cause for yellow stools. If it's clay color, that is white color ke stools, it could be biliary. So these are the few causes, and here you can see if there are any crystals present, if there are any undigestible waste, if there are any flat globules, they could be present. It's normal. It's not too something to worry, but ideally they should be absent because your body is capable enough to metabolize everything. Quantity, there should be 100 grams of stools. बहुत ज़्यादा stools भी नहीं होने चाहिए. Water, 75% of your stool should be made up of water. It should be semi-solid in consistency and the pH should be around 7 to 7.5. And these are the physicochemical and microscopic examinations: occult blood, fat content, sugar content, consistency, etc. One of the most vital parameters in diabetes mellitus is blood glucose. You have two types of diabetes, type 1 and type 2. In type 1 बिल्कुल भी blood glucose नहीं होता है body में. So in this, only insulin therapy is working. That you would have seen that some people have to carry their insulin syringes, insulin cartridges, pens. So they can themselves self-administer on the fatty tissues, majorly on the subcutaneous layer. So they have to either 3 times a day, 2 times a day. Type 2 is manageable because there are certain medications like metformin, tolbutamide, glimepiride, sitagliptin, vildagliptin, saxagliptin, dapagliflozin. There are certain acarbose, voglibose, rosiglitazone, pioglitazone that are anti-diabetic or oral hypoglycemia. But once you get diabetes, it is very, very important to manage it because आपको फिर से हो सकती है और वो diabetes mostly once you get it, it's for the lifetime mostly because it's very difficult to control the blood glucose level. So first thing that you go do is stop eating something that is sweet. Stop eating much of sugar, much of glucose. So you would have seen many foods as sugar-free foods or natural less sugar, or there are certain alternatives as well. So there are blood sugar के alternatives. So that doesn't mean कि आपको diabetes हो गई तो आप sugar खाना बंद कर देंगे. There are so many alternatives to sugar that are for diabetic patients mostly, like coconut sugar, that is coconut से sugar बनती है, and there are so many Naxtra companies there that sugar free. Stevia is a natural sugar, so उसमें कोई भी synthetic नहीं होते. Stevia rhabdoside करके आता है. That is also Sugar Light is one of the again very popular brand. So majorly biomarker used is HbA1c. So this stands for glycosylated hemoglobin. It should be mostly less than 6%. If it's more than 6%, you might suffer from diabetes. And next is GTT, that is glucose tolerance tests. So these tests are basically carried out to check the glucose level. But blood glucose कभी भी postprandial check नहीं करते, that is खाने के बाद. You also check it pre-prandial, that is fasting blood glucose. तो जिस दिन आपको blood glucose test करवाने बोलेंगे तो वो आपको बोलेंगे कि पहले कुछ भी घर से मत खा के आइएगा. Even if you're having it, see to it that you have it 12 hours prior and then go for testing. Because अगर आपने कुछ खाया होगा, obviously आपकी body में blood glucose बढ़ेगा, and that could be a misinterpretation for the diagnosis. Last is the miscellaneous tests, that is a C-reactive protein, CRP, D-dimer, interleukin, acid phosphatase, that is in prostate cancer. So in prostate cancer, this is a major biomarker, alkaline phosphatase. In routine investigation, you have different lipid profiling, liver function, kidney function, CRP, electrolytes, CSF, pleural fluid, synovial fluid, lactate level, amylase, cholinesterase, iron profiling, troponin, cardiac lactate dehydrogenase, cardiac troponin, ferroprotein, transferrin, fertility testing. Fertility is basically for whether a female is able to conceive or not, whether pregnancy, there are chances of conceiving or not. Those are fertility testing profile. So testosterone test, progesterone. Testosterone is for males. So it's not always necessary that it is because of a female that a child cannot be conceived. There could be deficiencies in male as well. This condition is called as oligozoospermia, where the amount of sperm is extremely less, and there could not be zygote formation due to this. So not all every time the females are to be blamed for this. Next is CEA, that is carcinoembryonic antigen. These are few high fundu testings that are responsible, and there are so many different colorimetric tests, chromatographic tests, spectrophotometric tests that are used for G6PD deficiency. So those who have malaria, if they have G6PD deficiency due to chloroquine, it is very mostly in Africans, in the people who are a little ethnicity is a little dark side, they suffer from the G6PD deficiency. BNP, that is brain natriuretic peptide, the folic acid, the BUN, that is blood urine nitrogen, GFR, creatinine clearance. These are few of the miscellaneous tests. And this is the last one, the test that is responsible, different test available. Number one is hematological testing. Next you have is biochemistry, cytology, biopsy or histopathology, serology, microbiology, stool, urine, fluid discharge, immunoassay, T3, T4, PSA, prolactin, that is milk secretion. So many a times when a female conceives, when the child is born, breastfeeding is very essential. But sometimes a female is unable to provide milk due to absence of oxytocin and prolactin. So at that time, the child needs breast milk only. So this are the tests that could be performed prior to pregnancy. HB, that is HB antigen testing, HIV ELISA testing, that is enzyme linked immunosorbate assay, or radio immunoassay, that is RIA. Vitamin tests. Next you have growth hormone tests that are very iron profiling, CRP, C-reactive protein, fungus staining, gram staining, acid fast staining, fungal culture, ABG testing, stools, urea cycle testing, fructose, semen testing, acids testing, ESR testing, tonsils, hemectomy, glycosylated hemoglobin, creatinine clearance, creatinine serum, blood urine nitrogen, acid phosphatase, ferritin, transferrin, platelet count, Westringen and Wintrobe method, DLC, D-dimer, complete blood count, CT scan, MRI, X-ray. So these are few of the tests that we covered today. I hope you enjoyed the video. If you did like it, kindly do share, subscribe and show some love. Thank you so much for watching the video.